is a doctor in the house. Dr Stuart is here. He's from the Village Medical Practice in Harrisdale. It's a pleasure to have you back, my friend.
G'day, Doug. Yeah, it's always nice to be here.
It is. And school holidays had a little bit of a break.
Yes. Yeah, it was
Although
nice.
You don't get a break, do you, over the holidays?
Oh, we can do.
You can do?
Yeah, patients can just get sick and wait, and then we can catch up with them when they come back. There's other doctors. It's all good.
That's all right. Yeah, just someone else can keep them alive.
There's plenty of other people to keep them alive around here.
Yeah, fantastic. Hey, now we're going to talk Parkinson's today. Now, this is something that is, I think, all of us are aware of. We've probably got a family member or someone who's been touched by Parkinson's. I know I've got a couple in my family that have experienced it. It's Parkinson's Awareness Month.
It is, yeah. So important to raise awareness, because I think there's a misconception out there that it's a little old white man, and it's just not. Yes, it does affect older people sometimes, and it seems to affect them disproportionately sometimes as well. But young people can get it too. I mean, the classic example that probably most people are aware of is the actor Michael J. Fox, who developed young onset Parkinson's. And for anyone who's on streaming services, they might be aware of a show called Shrinking, where Parkinson's plays a large role, and I think I've been gripped with it the last few weeks as I've been watching it. It's brilliant. So Parkinson's is this neurological condition that is progressive. So in doctor terms, that means, so neurological means it's involving the nerves. Progressive means it's going to keep getting worse. It's not something that will improve necessarily unless we do something about it. I mean, it's been around, we've known about it rather since 1817, and it's named after the guy that discovered it, James Parkinson, who originally called it the shaking palsy. And that's normally what most people will see, is it's a shaking thing, but it's more than that. It's rigidity of the muscles, and it causes all kinds of different symptoms for people, like they move more slowly, they struggle with balance and posture, things like their handwriting gets very, very small, or they can freeze when they're trying to walk through a doorway. They just can't seem to make their muscles work. It isn't a dementia, so it's not that it affects the brain, although unfortunately for a number of people with it, it can start to have cognitive impact as they get a bit older. So it has really, really tremendous impact on the people that it affects and the people around them as they try to support them through it. And the good news is there are good treatments out there, but it's something to be aware of. And I think in Parkinson's Awareness Month, it's actually really important to flag it up as something that, we don't often understand. We've heard of it, we've sort of seen people who maybe had it, as you say, people with family members who have got it, but it's not necessarily that well understood by the general public.
Okay. You said before, like, we know that Michael J. Fox has been a big advocate for Parkinson's, as he was diagnosed quite early. Who is it that gets Parkinson's? Is it like a particular age group that normally gets it? Where does it kick in, and what are some of the, I suppose, causes?
Well, certainly age is a big risk factor. So most people are diagnosed over the age of 60, but that hides the fact that actually a lot of people can be diagnosed much younger. So I think Michael J. Fox was under 40 or around the age of 40 when he was first diagnosed. So
I think
pretty young.
I think he was doing the Back to the Future films,
which
is why he had his hands in his pockets.
Yeah, so he was young when it happened, and so age is definitely a factor, but it shouldn't be overlooked that actually it does affect a number of young people. And when you think about that, it disproportionately affects younger people because they are potentially still trying to work, they're still trying to do all those kind of things, whereas if you're 70, 80, 90, as devastating as it can be sometimes, if you're not trying to work, it won't necessarily end your career or cause those kind of issues, and things like driving, all the other things that we take for granted. Sex is the other one. Men are 1.5 times more likely than women to get it, so that plays into it. And there are some genetic connections. There are some genes that we know of that can lead to Parkinson's, and those tend to run in families. So if we have somebody who is worried about a diagnosis, or whose family members are diagnosed, we can do genetic screening to have a look for some of these things to see. We know certainly that long-term exposure to things like pesticides, people who have had head injuries, people exposed to agricultural chemicals, they can all be potentially at higher risk. But most cases, there's no clear cause. It's just arisen, and that's just how it is. Okay.
So sometimes there's no clear cause to it. It can be just a a genetic
just
thing.
bad luck.
Bad luck that happens in someone's life.
For sure.
When it comes to the diagnosis, before you said sometimes it's a series of things that can build up before we see the actual tremors.
Yeah.
What does that diagnosis look like for someone, and what does treatment look like for them once someone has a diagnosis?
So there isn't really a blood test or a brain scan or a single definitive test. We know that it's caused by a breakdown of a nerve cell in a specific region of the brain called the substantia nigra, and those cells produce something called dopamine, which is one of the brain's key chemicals that coordinate, among other things, smooth movement. So that's where the movement issue comes in. We know that because we've chopped people's brains up, but that's fairly consistently shown to cause death when you chop someone's brain up. So we can't really make that diagnosis before someone passes away that way. So we have to use other factors. So for example, we look at all the symptoms. There's no blood test, there's no scan, so it's a clinical diagnosis. In other words, we take a history from the person, potentially from the people around them, we examine them and we monitor how those symptoms have been progressing over time. But it can be a long and frustrating journey, especially when some of those early symptoms are a bit vague or non-specific. So it can take a bit of time, and sometimes there are some dead ends that we travel down in terms of diagnosis before we get to the final answer. And I'm sure in years to come we will have blood tests or other things, but for the moment, unfortunately, it's a challenge.
Okay. Dr. Stuart, before you were just telling us about the diagnosis, and let's talk about treatment a bit more. What does treatment look like in giving people hope these days? Because I know that when my family members were going through it, we were doing some research, and it looks like there's some really positive changes and research coming out in this space. For sure.
There's some really, really exciting things. So the mainstay for many, many years has been a drug called levodopa, which is converted to dopamine in the brain. So we can give that. It's highly effective. So in the early stages, we give levodopa to patients, and essentially their symptoms largely vanish, or at least become pretty much unnoticeable to those around them. The biggest problem with that is it loses its effect over time, and we have to increase the dose, and eventually we hit a limit. And then it just becomes non-effective, and then we have to think about other things. There are other medicines that we can use, but there's limitations there. So we eventually seem to hit roadblocks with some people. But there are some super exciting things in the field of what we call deep brain stimulation, which is where electrodes are actually planted into the brain and then connected to a device under the skin. It's a bit like a pacemaker for the brain. And it sends this electrical signal that kind of regulates the abnormal brain activity. It's not a cure for Parkinson's, but it dramatically reduces tremors and improves function for many, many patients. So especially for younger patients and patients who are fit for the surgery, it can be life-changing, and it can give them their function back, at least for a considerable period of time. So that's been a game changer over the last number of years, and there are even more advances happening as we speak. There are really exciting things on the horizon in that field as well.
Yeah, that's cool. When it comes to like the day-to-day living, is there like exercise, diet, what are some of the practical things that people are doing to help themselves with Parkinson's? Because I know, when I look at my family members that have had Parkinson's, some of them, have just embraced it and gone, I'm just going to live my best life.
Yeah.
And I think that's a great attitude to
Absolutely.
have. But how do we put in the practical stuff?
There are definitely some physical things that we do recommend for people, things like physio in order to strengthen their muscles, improve their mobility and balance, these kind of things, because falls are a real risk in that kind of category. Speech therapy can be super important. So obviously we talked earlier about the voice softening, but one thing that people often don't realise speech therapists help us a lot with is swallow. So the swallow is a phenomenally complex mechanism. It involves a wide range of muscles, and they have to be coordinated in a very specific way. And as I'm sure you can imagine, when you've got difficulty coordinating motor functions generally, it can sometimes be an issue with swallowing, which is a massive issue for people if they can no longer swallow and eat properly, and they might need to be fed through a tube, or they might have to just have certain types of liquids or whatever. So speech therapy can be very helpful in assessing and supporting and treating treating that. Occupational therapists often help with things like adapting daily tasks in the environment, but certainly exercise has been shown to improve function and slow their symptom progression, and it definitely improves that mood and balance as well, because you can do more and you can feel more confident. So you want to give people that opportunity to lead more fulfilling lives for years or even decades after diagnosis.
Yeah. Are there support groups, organisations that can partner with people with Parkinson's to help them live their best life, to help give them information, to have hope and those sort of things? For sure,
yeah, and they're a huge support to both the patients, but also to their families, because again, it often affects the whole family, because somebody who was previously capable suddenly is really struggling. There are a number of groups out there that offer different types of practical advice, community support, and helping with isolation, which a lot of people can find as well, because they're not able to be as active in their communities as they'd like to be. So, and the Parkinson's community in particular is pretty resilient and pretty connected. So there are a bunch of groups out there that people can connect with. They're very easy to find online.
No, that's great. You said before that there was obviously the medication, the potential brain stimulation. What's the research in this space looking like? Is it exciting? Is it something where there's a lot of hope we can hold on to?
I mean, define exciting, Doug. You and I get excited about different things, I suspect, but this is very exciting from a medical perspective. Gene therapy is certainly something that is known to target those specific gene mutations that we talked about earlier. Things like stem cell transplants, which can be used to replace those dopamine producing cells, and that's an area that's being investigated not just for things like Parkinson's, but also type 1 diabetes in that area as well. So those research programs could potentially be complementary and move in the same direction. There's other early detection trials. There's a very interesting, so some people have a super sense of smell, and these guys actually, there's been some really interesting research where there was a woman who had this ability. She could smell something different about a person, and it turned out I think it was her husband, and he developed Parkinson's.
Wow.
And so she could tell years before he had any of the other symptoms, and so they did a trial where they got a number of people who had known Parkinson's and a similar number of people who didn't, and she smelled their clothing, and she got, say, 9 out of 10 of the people with Parkinson's she identified, and the 10th person who should have been identified but wasn't eventually got diagnosed with Parkinson's. So there are people out there who actually can smell an odour from people who actually have or are going to develop Parkinson's, which sounds wild. But it indicates there are other factors out there that we're not necessarily aware of right now, but hopefully will become. That could be a test potentially, if we can identify what that smell is, what that particular molecule is that she was smelling, then we can test for that, and we can give people years more advance notice and potentially treatment as a result. So it's exciting but weird.
Well, it is exciting, but it's a very weird.
I've been called exciting but weird many times, Doug.
Hey, it's Doug from Mornings on Sonshine. Thanks for watching this video. Make sure that you like, comment, subscribe, do all those good things. Share it with a friend who might get something out of it, and I'll catch you in the next video.